Kimberly and I have been asked by ADAO this year to talk about issues surrounding quality of life. So quality of life is a buzzword that we are all familiar with. It's usually associated with living with serious illnesses. But quality of life is important for everyone. Let it be if you're facing a serious illness, or you've recently lost a loved one, or even if you're a busy professional. But what exactly does quality of life mean? It's finding satisfaction within your life, happiness, enjoyment, contentment. What does it consist of? Well, that's different for everyone. You have to look at the priorities in your life, and what equals quality of life for you is an individual definition. And I encourage each and every one of you to think about what it means for you, because it's a very individual process. Quality of life is just as important as taking care of any other responsibilities in our life. And it doesn't just automatically happen. It takes a concerted effort sometimes to find the balance to incorporate that into your life. Now, although I just said that quality of life is extremely important and should be a priority that you build into your life, first you need to cover the basics. The pyramid is called Maslow's Hierarchy of Needs. And it kind of spells out the logical prioritization of needs that human beings have. First you need to cover the basics of food, shelter, managing or maintaining your health, and having a sense of safety. Once those needs are met, you can focus on your emotional needs, support, love, a sense of companionship. And once those needs are met, that's when you can think about personal fulfillment, satisfaction of life. In order to manage those basic needs, so that you can then focus on quality of life, you can begin by managing your environment, your external world. This is important because when stresses become chronic in our life, and often overwhelming, it makes each new stress harder to deal with. So in order to be proactive, learn about your situation. Knowing what to expect to a degree can help you be prepared to address and adapt your life to maintain quality of life. Take stock of your skills and resources and be willing to use them. Accept help from others when you need it. It's often hard for many of us, but it can help us most effectively manage our environment. Stay open-minded. Flexibility, problem solving, and a willingness to adapt are key. Now, although we all do our best to manage our external world, it is also recognized that what goes on inside our head can be an entirely different world. With so many emotions, a million racing thoughts, it's important to remember the power of perception. Often, people's perception defines their reality, and it can be more true than the facts of the matter at times. Our perception is shaped by our view of the world, our past experiences. It's important to be attentive to our internal world so we can find the balance to continue living with quality of life despite the presence of an illness. We all know that feelings of grief are associated with loss. But a loss to be grieved is not just the loss of life or the loss of a loved one, but also the losses of the inability to function, to do the things we enjoy, to fulfill the social roles in our life. We all have heard about the 5 stages of grief that you supposedly progress through. But if you've ever experienced grief, there's nothing orderly about it. It's a tornado of emotions, and one day you feel one way, the next day you feel another way. It can be exhausting to to live amongst a whirlwind of emotion, and it can be paralyzing, leading you to withdraw from life instead of to embrace quality of life activities. So how do we survive the emotional storm and maintain quality of life? It's important to recognize that it's okay to have these emotions. It's actually very normal for what people are confronting. It's also important to find a healthy release of emotion, so you don't let yourself get caught in a vortex of spiraling emotions that is fully consuming without a way out. And if the emotional distress becomes overwhelming at times, it's important to find ways to distract yourself. Focus on the little things in life. Try to use your supports. Using your supports doesn't mean you have to talk about your illnesses or your challenges. It can be talking about the weather or a favorite sports event that occurred. Just some way to distract yourself from the emotions that can be overwhelming. Self-soothe with immediate sensory input. Listening to your favorite music, enjoying a cup of coffee, the smell, the taste, and never underestimate the power of touch. It is also important to be aware of what that voice in your head is saying. The way we think, the messages we tell ourselves definitely have a ripple effect. Watch out for cognitive errors. These are patterns of thinking that can sometimes be to our disadvantage. Like if we take oversimplification. Initially, when we simplify information, it helps us break down all the confusing and overwhelming information that comes with a new diagnosis. But if we get stuck in that spot, it prevents us from complete understanding, which could help us adapt in ways to maintain quality of life. So be aware of your thought processes. Faith, religion, spirituality, however we define this for ourselves, it is an important part of who we are. It often helps us make sense and deal with the challenges and struggles we are confronted with. Hope is also very important. There is no such thing as false hope. We know there is no guarantees, but hope gives us faith in the future. When the course of your illness and your future is unpredictable, which life is for all of us in many ways, it is so important to always maintain quality of life. One of the most valuable lessons I have personally learned from working with people with asbestos-related diseases is not to wait for your golden years to focus on quality of life and the fulfillment of your dreams, as you never know what the future may hold. So make activities that enhance your quality of life part of your daily life. Remember that your illness and your physical state is just one part of who you are, and so make it a priority to have a little time away from your illness. And if it's difficult to turn your illness off sometimes, do something that requires focused attention. If your mind is talking too much, read a book. It's hard to think and read at the same time. Stay in the present. Focus on the things that are right around you. And if you're still struggling, think of those activities we just talked about ways to distract yourself. Keeping a balance in your life that incorporates quality of life activities doesn't always just come automatically. It takes a real focus and intention to maintain quality of life sometimes. There is no doubt that at times you and the important people in your life will experience frustrations, difficulties, and challenges. But don't forget, everybody is doing the best they can in the situation they are in with the skills and resources they have. So be patient with one another. Yet with that being said, It's never too late to learn new skills to better deal with our situation, which can help maintain and maximize your quality of life. And this is what Kimberly Rowse will further discuss.
I always find it advantageous to follow Tanis because this is kind of my disclaimer. You know, I'm doing the best as I can in the situation that I'm in. So as a registered nurse, I not only bring the expertise as a registered nurse, but again, my most education comes from our patients and our families, from caring for them from every day in the clinic in itself, as well as interactions within the community, and understand what their quality of life is within their home environment and within their community, and how best they manage that. So I think that I'd like to start with, Tanis talked a lot about our emotional status and how we maintain our emotional well-being. And so I'd like to start a little bit with an exercise. And some folks may call it like a cleansing breath, or just breathe. And we oftentimes will use this with our patients. And what I want you all to do is just try and relax a little bit. We're going to take a deep breath in, and I want you to take a deep breath in. Clear down to your belly. Clear down to your belly. Okay? Deep breath in through your nose. And we're going to hold it for a few seconds and blow it out through your mouth. Just feel your muscles relax. Feel the stress melt away. And this is a good exercise for all of us, not only for stress reduction, but also for our patients, for the stress reduction, to get them centered. And as well as it also helps to exercise those breathing muscles that oftentimes those of us that are not affected with breathing issues don't really consciously think about breathing every moment, every day. My presentation today is going to talk, I'm going to touch a little bit on the cycle of communication, how we send and receive communication. Straight talking for good health is very important when we engage with our healthcare providers. I'm going to talk some about our symptomatology that we all deal with, some of those things such as fatigue, that you're just so tired you don't think that you can go on. Tips for saving that energy and maximizing those high points. Exercise and healthy weight is a huge component of our health maintenance. Medication management, how we can best maintain our medication regimes. I'm going to talk a little bit about intimacy and healthy sex. We all need to identify good sleep hygiene. And lastly, we'll talk a little bit about research and how important engaging in research. So once again, we all communicate every single day of our lives. But I think when you're impacted with a situation, it's most important and most critical to develop those communication skills in order to communicate with your healthcare provider, as well as not only share with them what your needs are, but also to be an attentive listener as to help with your treatment plan. So communication is a very dynamic process. It requires active participation from both parties. First off, the sender identifies a clear message and sends that message off in words, in body language, in the intonation of their voice. Through that it will go to the receiver, and that receiver will receive that information, and again, they takes that active part of active listening, and also it's important that the sender will send that message in a clear manner. It's very important, and as we all know, in the medical arena, we completely talk a different language. And so it's very important as we talk to our patients that we're conscientious of not using medical language or jargon that they may not understand. Certainly, I recognize in our environment, it's important to understand the education level of our patients, sensory deficits, whether it be a hearing or whether it be a learning, or whether it be a cognitive type of deficit that we may have. It's important for the sender to give that in understandable terms and not only send that message, but validate that message is heard. Now, as we all have had different experiences in our life and been on the receiving end, oftentimes when we receive devastating news, we get snips and pieces of the information that is sent to us. So as our role as a patient or a caregiver or a family member that is taking part in a patient's care, it's very important to be an active listener, to focus on what is being told to you. It's very appropriate to take notes so you can reiterate back to who you're communicating with what you understood and what you felt was actually said to you. So it's important to validate the information that you receive, as well as having the opportunity to ask questions and walk away where you're both on the same sheet of what you all talked about. Some of the factors that impact communication. Certainly the information as initial and ongoing. Anytime that we've received bad news or bad diagnosis, or it's that initial impact of disbelief or it can't be happening to me, is always an impact that oftentimes that's all we may hear. So, and also it's the ongoing stressor of wondering what comes next. Okay, you've dropped the bomb on me, what comes next? So that may influence of how we send and receive information. Also confusion and frustration. Again, using understandable terms, but we also may be angry or very frustrated about the situation that we're in. Why me? You know, why did it happen to my husband or my daughter or my son? Why can't these medical people, you know, just talk straight to me so I know and expect what is going on? Oftentimes it's the lifelong nature of the disease. You know, when will this ever end? Will I ever get any bad news? When will I be able to, you know, have some type of grounding in order for me to move forward? And predictable consequences and impacts. Again, you just never know what's going to happen next. And oftentimes when we are, when we're stressed, that we oftentimes don't receive all of the information. So that's why it's important that we validate what we actually hear. Straight talk for good health. Most importantly with this, it's just very, very important that you develop a very trusting and working relationship with your medical provider. And you need to set that groundwork right from the very beginning. So make a list and be prepared for your visit. Talk about your new symptoms, your changes from your last visit, and update any of your medication lists. Ask those hard questions. What's your treatments? What's going to happen with my medications? What do I need to know about my disease or disorder? And get educated. Once you walk away, ask some of the staff there that where can I go for more information? Just have a little quick slide. NIEH has wonderful sites for communication and learning about disease processes. Fatigue. We all feel fatigue at one point in time in our existence, but fatigue is defined as tiredness that does not get better with rest. There's physical fatigue that is an imbalance of exercise, sleep, diet. There's mental fatigue from ongoing stressors in our lives. There's secondary that can be caused by medical conditions. And then there's chronic that lasts more than 6 months. Tips on saving energy. Certainly, you know, that is, we all try to preserve and utilize those peak times when we have most energies. Set priorities of what you need to get done. What's important to you. Make those moments at your peak time. Plan ahead so you know if you get tired in the afternoon that you can do those activities in the morning and organize your time. And pace yourself throughout the day. Also, rely on others. If you need help, you need to be very honest, and it's very hard for us to ask for help on occasion. But there's so many people that reach out to us, and don't be shy. You know, you need to let them know, and that's part of giving back to you. Exercise, one of the biggest barriers to exercise is shortness of breath and fatigue. Well, if I'm so short of breath and I'm so tired out, how in the heck do you expect me to get out of my chair and exercise? But, you know, the most important point of exercise is it will allay all of those consequences of inactivity. So it's a vicious cycle. You need to get motivated. You need to, it doesn't need to be hard. You can pick activities that you enjoy and are nearby to you. Plan it so it's interesting and fun. Take a buddy, take a dog. Be realistic about your time and your physical well-being. Weight management. Once again, it's very important to manage our weight in the presence of disease management. It's not only maintaining your weight as far as healthy weight, but making sure underweight is addressed as well. Interacting with a dietitian is a wonderful opportunity. You can learn so many tricks of the trade that can help to maintain your weight effectively. And also it will help with your breathing. So just the workload of breathing in itself can cause poor appetite or increased caloric utilization. So some folks may need nutritional supplements. Medication management. Medication management, oftentimes we end up with a pharmacopoeia of different medications that it's so important that every single time that you go to your provider that you maintain that log of the date prescribed, your prescribing medication, the name and dose, because as many medications that we're on, it's very important that your provider knows about what you're taking. A little bit about intimacy. It's just very important that so many times when we are in a caregiving environment that we're so busy taking care of the one that we love that we forget to love the one we're with. And so be determined about your touch. Let them know what your feelings are. Ask your partner, about what their feelings are and how you can help them be more intimate and not just feel like they're cared for, but actually loved. Sleep is important. Sleep hygiene is huge. Establish a routine, short naps, an inviting sleep environment. If you need help with sleep, you need to communicate with your provider. And lastly, I really encourage all of you folks, if you have the opportunity to be involved in research, to explore those opportunities, because research is the care for tomorrow. Thank you.